Hello, dears, and welcome to Al-Hussaini Virtual Lab Pathology Talks, Tips and Practical Tips. What I'm going to be sharing with you today is a nice example of a typical lipomatous tumor or well-differentiated liposarcoma. So this is a case of a 37-year-old female patient who presented with a large mass in the left thigh. And as you can see here from the low power magnification, this is a fat-producing tumor, lipomatous tumor. On the right-hand side here and the left-hand side here, the tumor looks exactly like the usual lipoma. However, if we focus in here into this part, you start to see variation in the size of the lipocytes. So some of them are really big, others appear to be really small. And one hint also from the low power magnification is that you start to see the nuclei. Usually in the lipoma, in general, you do not appreciate the nuclei from low power magnification. Whereas in areas where you start to see this atypical lipomatous proliferation, you start to appreciate the presence of the nuclei from the low power magnification. And this is an important small tip that you should pay attention to. Now, zooming in into this area, again, we have some very large lipocytes, but here we can really appreciate the variation in the size of the lipocytes. Some are intermediate in size, others are really small, and again, the hyperchromatic nuclei. However, these hyperchromatic nuclei are not only confined to the lipocytes or themselves, but also to some hyperchromatic nuclei in the stroma, in the fibrous stroma in between. Further on, zooming in further, you can start to see some lipoblast, and these are smaller cells with more than one vacuole that is indenting the nucleus. And again, this small lipoblast is seen adjacent to this very large lipocyte in which the nucleus is appreciated. This is another focus. Look at the hyperchromatic nucleus of the lipocyte here, and then this one, for example, a hyperchromatic nucleus that is seen in the stroma, in the spindle cell stroma in the background. And I think from this high power magnification, you can appreciate the tremendous variation in the size of the nuclei. This is another lipoblast where the nucleus is being indented by two adjacent small vacuoles. Again, another focus. Look at the hyperchromasia here, some lipoblast here, hyperchromasia here, some stromal cells, and again, the appreciation of the pleomorphic nuclei that is seen in this high power magnification. Now, S100 protein was just done. This is routinely done, and again, it does not carry any prognostic or diagnostic actually significance. It's only part of the routine stains that we do, and the nuclei as well as the rim of the cytoplasm show the positivity. Now, actually, this case was subjected to testing with DNA profile methylation, and the methylome classification using the sarcoma classifier version 12.3 came as if it is suggesting the diagnosis of well-differentiated liposarcoma. The calibrated score was not high. However, what was really very helpful in supporting the diagnosis, especially that the differential diagnosis would be a lipoma, only a lipoma with no evidence of malignant features or no evidence of liposarcoma. This was the main differential diagnosis. The copy number variation that is usually part of the report of the methylation profiling beautifully showed the presence of the MDM2 amplification here, where we have increased number of copies of the MDM2 gene. This is also here at a partial amplification or gain of the long arm of a chromosome 1, which is again reported in a subset of well-differentiated liposarcoma or atypical lipomatous tumor. In order to confirm the diagnosis further, we elected to do FISH testing for MDM2 amplification. And as you can see here beautifully, this is the central centromere, and this is the gene showing several copies, which is consistent with amplification of the MDM2 gene. And then we resorted to do the immunostain, which is the least, actually, it's not that sensitive, and sometimes interpretation might be difficult. And again, in this case, supporting what we saw within the copy number variation profile testing, and within the for the MDM2 amplification, you can see here some nuclear staining that is seen in some nuclei of the atypical lipoblast, supporting the diagnosis. So the final diagnosis in this case is atypical lipomatous tumor, or sometimes known as well-differentiated liposarcoma, depending on the origin of the tumor. If this is in the soft tissue, most frequently occurring in extremities in the thigh, as in our example, we tend to call it atypical lipomatous tumor. Whereas if the same tumor occurs in the retroperitoneum, we tend to call it well-differentiated liposarcoma. Remember that the low power magnification can hold an important tip to the diagnosis, which is the hyperchromasia of the nuclei that can be appreciated from low power magnification, in addition to the appreciable changes or differences in the size of the cytoplasm of the tumor cells, where the vast majority might be like well-differentiated large lipocytes. But once we see this variation in the size of the cells, this is an excellent clue to the suggestion of the diagnosis. Remember that lipoblast can sometimes see, but it's not a requirement for the diagnosis. And remember, perhaps while MDM2 immunohistochemistry can be helpful in supporting the diagnosis, you really need more robust type of confirmation for the diagnosis, including FISH testing, for example, with MDM2 amplification, or if you have the resources and access to methylation profiling, then copy number variation can show MDM2 amplification alone, or in the presence of others like the 1Q amplification. I hope you find this tip useful in your daily practice. Thank you.